Hi, I'm Josh Mailman. I'm the president of NorCal Carcinate Community, and I want to thank you for attending this session today. My session's called Decisions, Decisions, Decisions. And really, it's about the challenges of making decisions and where we are today with neuroendocrine tumors and helping with that decision making. Just a few quick disclosures. First of all, thank you to the LACNETS team for this invitation. All views are my own, and NorCal Carcinate Community, as well as other nonprofits that I work for, receive funding from the following. So what are our topic areas today? Well, it's that decision thing. And really, we're going to cover two things, decision challenges and understanding your goals. And goals may mean something different than you think it means. So first of all, the decision challenge. Now, I was diagnosed way back in, it feels like forever ago, 2007. And back then, I didn't have that many options. I wasn't a surgical candidate. I wasn't available for any clinical trials. And there really was nothing to treat my advanced disease at the time when I finally started getting symptoms and my tumor started growing. So I was left with a relatively easy decision. I had progression. I could do PRRT, and at that point I had to go overseas to go do that, or do nothing and look at various different palliative or hospice care. I chose PRRT as that was my choice, and my decision was really easy. And I think of the Devo song of really what we want is freedom from choice. I didn't have that much of a choice, so it was easy. Now, what are you facing today? Well, that's different. This is the decision tree that you're looking at right now. On the left is the decision matrix, and we'll talk about where to find these later on in this presentation. But this is the NCCN guidelines, the National Comprehensive Cancer Network, and they do a flow chart for almost every version of a neuroendocrine tumor that will give you the idea of where to go. Is a complete resection possible? Well, then resect and then go to surveillance. If not, use some type of somatostatin analog therapy or manage clinically, depending on what's going on. If you have progression after that, well, you can see the right-hand side. There are 8 options right there that you can see. And that doesn't even really cover that in clinical trial, there's maybe 10 options inside that one option, or in liver-directed therapy, there may be 3 different options for you. A slightly easier matrix to look at, this is the University of Iowa's treatment matrix on the right, and you can still see it's rather complicated to follow, and there are decisions at every time and at every turn. So how do we make those decisions? How do we deal with all the ors? I mean, uncertainty is probably one of the biggest challenges for those of us with cancer. Well, there's very few head-to-head trials to guide us. Most current drugs that we have for us were trialed against placebo. They were the second group, other than the study group, was really on nothing more than observational. There's some exceptions. The NETTER-1 trial that approved Lutathera went against double-dose LAR. Newer trials are being done against what might be the current standard of care, thinking of COMPETE and COMPOSE. Those are 2 different PRRT trials that use active comparators or active comparatives arms. The ACTION-1 trial that is also repeat PRRT trial with an alpha is going against actually what's known as dealer's choice or investigator's option, so that you can do whatever standard of care is. Sorrento, which is a clinical trial for a sub-Q somatostatin analog therapy, is going against current somatostatin analog therapies. And then the National Cancer Institute also has a few trials that are going against what we would call current standard of cares for either lung nets or pancreatic nets. So that's really great in that sense. And we may have some answers on some of those ors, but that may take some time for us to find out. There are also patient-reported observational studies, and we'll talk about those real quick. In the middle of the pandemic, I was fortunate to work with the University of Iowa and get a $5 million PCORI grant to understand a little bit more of how we do with different treatments, the side effects over a nearly 2-year period. And so we can get some answers on how different people are responding to different treatments, and maybe that might inform us. UCSF is also doing a trial, a pilot project, which will now flow into a larger project called Net Voices that will try to understand the medical history, the symptoms, how social support in various different domains fit into our care. But these are not going to be providing definitive data for you to make your decisions on for several years, and they may not even provide definitive data then. So let's shift. How do you make that? And I said the word goals before, and really I want you to think about goals of really decide on the goals that you want, understand your treatment options, analyze the benefits and risks, learn to use your language to speak to your provider, set your ground rules. So while goal is the first thing, goals is the overall idea of how to manage your decision. So let's talk about that. What is the goal of treatment? Are you looking for a cure? Is it a curative option? Now, I know we don't use the word cure that often in NETs, and so we can say that, no evidence of disease. But if we have that possibility, you may be willing to take on more risk depending on where you are in your life and what other major milestones are out there for you. Control, that's a multitude of possibilities in neuroendocrine tumors. That could be symptom control or tumor control if the tumor is growing and getting too close to something that you and your medical team want to take care of. And that may be also comfort, the goal of treatment being comfort of you've exhausted many treatments, it's you just want to be comfortable and control your symptoms as you figure out what to do next. You really need to layer on top of that your personal goals and milestones, whether you're waiting for a milestone birthday, a wedding, a graduation, your bucket list of travel, that helps you set your goals that you need to communicate to your team. Understanding your options. Now, this is, we talked about those NCCN guidelines. There's two things. There's a patient version, and I put the URL up here, and they have a patient version that does not get updated as often as the physician version. It does not require registration. But if you do register, and it's a free registration, you can take a look at the physician version of the guidelines. And these will give you the detailed charts depending on your specific diagnosis of NETs and what that flow chart is. So I recommend looking at both. Now, what are your available clinical trials? This is complicated. Clinicaltrials.gov is not the easiest to navigate sites. You can put in the word neuroendocrine tumor and come up with several hundred active clinical trials, but those are probably not all neuroendocrine tumor trials. There are some challenges with the way clinicaltrials.gov is laid out. And so I've been working along with NorCal CarsaNet and members of the NET community with a company called Ancora AI, and we will shortly be coming out, and by the time you're seeing this presentation, we will have a live beta on actually a clinical trial finder, and I'll show some slides from that in a second. So we look forward to you trying that to see if you can find clinical trials that meet your requirements. Seeking a second opinion so you can better understand your options and rationale. So when you do seek a second opinion, it's really important that, one, you go to someone knowledgeable about NETs, and many people consider that a NET specialist, and there are many different ways to find them. We're lucky both in Northern California and Southern California to have several NET specialists in different disciplines available for second opinions. But more than just getting another treatment option, you really need to understand the rationale behind that second opinion so that it can help you make decisions as you go through your path, as we go through our disease. Because unlike most cancers, we will have normally several opportunities to make treatment decisions, and talk to fellow patients about their experience with the options that you're considering. So back to Ancora. This is just a quick set of slides here that will give you an idea of what it will look like. You'll be able to put in the fact that you have a neuroendocrine tumor, and actually this will be made available at different websites, and you won't even have to put in the word neuroendocrine tumor. You will put the location and put search, and you will actually go through a questionnaire. It's about a 10-question questionnaire that will try to define what type of inclusion and exclusion criteria you may have. And at the end of that, you'll be presented with a set of curated clinical trials that meet your specifications. And actually, as you can see at the bottom of each of these clinical trials that I'm showing, you'll get a relevance so that you have an idea. Even though it came up with 68 neuroendocrine tumors, this is still a beta that I'm working off of here, it will give you an idea of the absolute relevance to you based on what your questionnaire is. So we hope this will help people find more meaningful clinical trials to them when they need it. So language. In 2017, I had the honor of traveling the country doing what we call the Speaking Up Tour, where we went to 14 different cities around the country and talked about how to talk to your medical team. So this is a video that we did. You can click on the norcalcarcinet.org site, Speaking Up. But really, the big points here are speak up when you don't understand something. Make sure your medical team understands your goals. Write your questions in advance. You can even use your online portal to do that. With permission, record your conversation. Bring someone with you, and you'll find that recorded conversation really helps you. I know in one of my first surgical consults, myself and my wife disagreed on what was said. And we went back to that recording and found out we were both wrong. So really do ask permission and see if you can record. Every one of our smartphones has some type of recording device on it. Keep, and I should say also get copies of your medical records. We rely heavily, many of us, on MyChart, and that is really great and it does have a way to export your records, but especially for the imaging records, the images that are there are not good enough for someone else to do a second opinion of. So that's why at the end of every imaging session, I ask for a CD as I'm actually doing the image, so that by the time I get out, I'm able to have a disc that's with me, and I have a collection of all of my discs, and there's different ways to actually store them and transport them to others. But make sure you have those copies of your medical records and your testing. Lastly, the S in goals. Set your ground rules. Decide how much you want to know, when you want to know it, how you would like to be told about different things, and communicate that to your medical team. Decide how you want to make your decisions, and actually make sure you communicate that to your medical team as well. That may be working with your family members or a group of trusted friends, and understand that when you talk to other people, they're going through their own experience, and certainly take that in, but know whatever decision you make will be right for you. Do have realistic expectations. This is a challenging thing with NETs because we don't really have a cure. We do have no evidence of disease, possibilities after surgery, and this could be a cure with follow-up past 10 years, but realistically, know what your expectations are. Understand that not all treatment leads to significant reduction of disease, but may lead to a long term of no symptoms and no growth. Make sure the focus is on you. That's actually the most important person in this conversation. Accept help, and that is from your friends or your family. And if you're not able to or don't have friends and family, we have great support groups. There's the mentorship program here at LACNETS. as well. And many places like cancer support communities have different programs that will help you make those decisions. Lastly, more importantly, and I usually use some version of the slide in almost every presentation, so I decided to add a different one as well. Enjoy every sandwich. This is from Warren Zevon when asked about how he felt after his cancer diagnosis and what he learned. Is that really, it's a metaphor for enjoy life. We're going through these treatments and trying to prolong our life with great quality so that we can actually enjoy every sandwich. I added a little Jimmy Buffett here as breathe in, breathe out, move on, because you're going to make a decision, and there is no perfect decision and there is no wrong decision. So make a decision, understand what you've made, know that you'll get to make most likely another decision as well. Keep studying, keep understanding your disease and what is going on, and breathe in, breathe out, move on. And with that, I want to thank you for your time. I hope this has been useful to you.